see marked thickening of the dura with the spinal nerves, and hence it does cause compression of those nerves and then inflammation. So as I said, this is just a refresher of what you did in anatomy. We won't go into it too much. Now this is probably something you didn't talk about in anatomy, is cholesterol-granulomas or cholesteatomas. They are non-neoplastic, even though they form sort of a mass. They're related to inflammation, so you have accumulation of cholesterol and macrophages. So hence we call it cholesterol granuloma. So we see cholesterol clefts or crystals, and then we see a granulomatous or macrophage inflammation associated. It's typically incidental finding in old horses, and they sort of accumulate in more commonly the lateral ventricle. But if you have a large accumulation of these nodules or masses, it can cause compression and indirectly affect the rest of the brain. As it advances in age, you may see fibrosis associated with it, but the typical lesion is that of just cholesterol and macrophages. So this is a close look at a cross-section of a cerebrum of a horse. So we're looking, this is white matter, gray matter, ventricles are here, and these brown masses within the ventricle are cholesterol granulomas. And as you see, they're fairly small, and you know, if they stay that small, they're not going to affect the ventricles, but as they get larger, they can cause compression to the rest of the brain. This is another ventricle where we see the accumulation of these cholesterol granulomas. So they can be predominantly brown to sort of brown to white in appearance. And as you can see, this one is causing some hemorrhage to the sort of the lining of the ventricle. So they can cause issue, but typically they're non-specific injury and incidental finding when you do a necropsy. This is an H&E section of a cholesterol granuloma. So what are these things called? You remember from last semester? They look like shards of glass. They are cholesterol clefts. So cholesterol cannot be processed when you make an H&E slide. It gets washed out, especially when you use the alcohol, and it leaves sort of shard-like or glass-like shards or clefts within the tissue. So those are cholesterol clefts. And then if you can kind of look closely, you see an inflammatory response associated with it. And even though we can't see them closely, we know because this is a cholesterol granuloma, those are macrophages in the background. So all of these are macrophages surrounding cholesterol clefts. So this is a typical microscopic appearance of a cholesterol granuloma or cholesteatoma. So if I give you the gross image and then I give you this microscopic image, you should be able to come up with a definitive diagnosis. Any questions so far? And to end off CNS, we look really closely, or not closely, briefly at tumors, because you should have done that last semester with Dr. Gilbreth. And some of the common tumors include meningioma. They originate within the meninges, and they're in close contact with the dura. So as I said, from when we started CNS, though these, I would say all of the tumors that we look at and associated with the brain are going to be benign, but as they grow and expand, they cause compression and then invade the surround, not invade, but affect the surrounding brain parenchyma. Most common tumor we see in cats and dogs, and I believe this is a video of a gentleman having one removed. So how do you think they can remove brain tumors? How do we decide to cut them open the brain? What do they do in Grey's Anatomy? They use a what? A like the ultrasound sort of a vibration. That's one way. Depending on where it's located, they typically go through the cribriform plates, so within the nostril, and depending on where the mass is, you can easily, get it to be smaller. I need to be watching Grey's Anatomy. So this is a meningioma. So this is the brain of a cat, cerebellum at the bottom. We still have the meninges attached. And what you're seeing is a mass that looks like it's growing from the meninges. So this sort of tissue will be the meninges, and this nodule is the meningioma. Now if you look at the associated brain parenchyma, what did it cause? Compression. So there is sort of a cavity within the brain because of this mass pushing inward. So your morphologic diagnosis would be a cerebral meningioma. Astrocytomas, we see them in the dog, and they originate from obviously astrocytes, and they can occur in the brain and spinal column. They can be difficult to detect grossly, and the reason is, compared to oligodendrogliomas and other tumors, they have the exact same color in terms of presentation when you look at them grossly. You probably can see other things like maybe compression of ventricles and compression of other areas. So this is an astrocytoma. And though you can see a fairly well-defined mass, in terms of color, it has a similar presentation of color to the normal brain tissue. But as you can see here, it is compressing of the ventricle and then can lead to other things associated with that. So astrocytomas, important to know, color is similar to the rest of the brain, and you do see it commonly in dogs. Other tumors include oligodendrogliomas, ependymomas, which are originated from the ependymal cells, medulloblastomas, and those come from Purines cells, and they are common in the cerebellum. And then metastatic tumors that can occur from the mammary glands to the urinary bladder, they can all metastasize to different areas of the brain. This is a medulloblastoma. As I said, they are primarily within the cerebellum, and this is the cross-section of an equine brain. So this is the cerebrum, and this large expansile mass within the cerebellum is a medulloblastoma. And so, quick review, we talked about cauda neuritis of cauda equina, as well as cholesterol steatomas. Again, we didn't spend a lot of time on these because, again, that's not as common. And then we talked about some CNS tumors, which include meningiomas, astrocytomas, and then these are the other ones that we less commonly see. So brain tumors, though they occur, they are not the most common disease or neoplasia we see in our animal species. All right, so we still have 19 minutes. What, yes?
So are we not covering parasites?
No, we're not going to do parasites now. Is it on your PowerPoint?
Yes.
Hopefully you did it in parasitology. Yeah, as you see, we didn't have time to, there are a lot of things, not a lot of things, but there are some areas in parasitology that I still am concerned. And so I may have to have a meeting with the third year instructors to see where we can add that. Usually, typically, he does it during the rotation, but...
I Also, real quick.
Yes.
The trauma portion.
Mhm, no.
Concussion, concussion.
Just only what I've gone up to, which is neoplasia, yes.
So not wobbles either.
Well, we talked about wobblers already when we looked at the bone, so we don't need to take that. So anything that's on your PowerPoint that I did not go through, just delete it. Because we already did wobblers and the parasitology stuff, I took those out as well. You have a question, Jared? No, you should. Any questions? Yes, Cameron.
Oh, okay, never mind. I was just making sure for the same thing.
Okay. Alright, that's, so please, Crystal, your camera, the video.
Oh, sure.
Turn it off.